Yeah, good morning to you, Cal. You know, COVID-19's impact on communities of color being hit hardest by the pandemic is something that we've been talking about and waiting to see in terms of numbers, right? Why haven't there been numbers released on how this is affecting low-income communities of color? So let's bring in Public Advocate Jumaane Williams now to this conversation. Good morning to you, Public Advocate. Thank you for joining us this morning. You know, I was reading a New York Times report yesterday about specific cities in the United States where we're seeing this hit particularly hard in communities of color, but that data does not exist for New York City. Why? What's the delay here in getting those numbers released?
Well, first, I want to make sure that we understand that everyone's going to be hit by this. And I want to uplift all families who are dealing with this right now. The virus itself doesn't discriminate. We see that. But the policies and response apparently have been, because, as you said, across this country, the people who are hit the hardest are communities of more color. And that's for several reasons. We came in with structural deficiencies in these communities, but our response has exacerbated and highlighted those deficits. And so I didn't expect to see leadership on a federal level. We have a president that I don't think is capable of it. But what we should have seen in places and states and cities where we call ourselves progressive, we should have seen a different trend, and we didn't see that. And that's because areas that we had control over, we didn't really put policies in place to protect these communities.
So yeah, you say 75% of the frontline workers are in fact people of color. So break that down for us and what exactly that means in terms of numbers of positive cases that we're seeing, and what kind of policies are you talking about that you would have liked to have seen in place prior to this?
That means frontline workers, anyone from sanitations to nurses assistants, to people who are working in supermarkets, who are stocking supermarkets, the cashiers, all of the people we were told were essential workers. And it seems like we didn't do the things we needed to do to protect them, almost as if they were expendable to make sure that the city was going. The city kept going. You can include postal workers. You can include transit workers. We didn't tighten the city fast enough. We didn't lock the city down. Even now, the city is not locked down in the way we should have. And that was under our control, and we didn't do it. And so when you're sending mixed messages, when you're telling people they need to shelter in place, or you're saying we need to pause, but you see leaders walking in the park, you see construction sites moving and keeping going. You see businesses that should not be open still open. That is sending mixed messages. And it was unfair to send these folks and say that you're frontline with no PPEs and with not really a real strong message to reduce congestion in the city. And we still have time to do that. And we have to make sure that we're lessening the congestion. Go ahead.
Culturally and economically, a lot of these people can't afford to practice social distancing, right? So I want to talk about, because they have to be out there on the front lines, they're deemed essential workers. Do you see adequate testing in these communities right now, or would you like to see more?
Well, one, we never saw adequate testing from the beginning. My office actually was calling around at the beginning when we heard anecdotally that the testing wasn't going, may not have been happening equitable. And there were places where people didn't have access to it. And obviously this has been backed up. But I want to back up for a second, because we have to reassess right now who is an essential worker for at least the next week or at least 2 weeks from now. Laundromats, cleaners, they have to shut down for at least a week. If we look at construction sites, they have to shut down. We have to zone the city so that grocery stores are delivering just to certain zones. The reason that these communities don't have the same access to some of the richer communities of staying inside and have things delivered to them, we have to address those needs. We kept saying that we were in a wartime, but we didn't have wartime plans. And that's local leaders who didn't put those plans in place. And even today, we have the ability to do it.
You're having a rally today. Yep, you're having a rally today to talk about this, right? Specifically about the communities of color. But what would you like to see done moving forward in terms of helping communities of color? And what are you going to be talking to the mayor about if you have that conversation with him?
I will be having a press conference with Borough President Eric Adams. We want to see a plan that is aimed and geared toward these communities in particular. We want the city to be truly locked down. It isn't. There's still too much mixed messages to make sure that to allow people to go outside. We want to see a zoned city where people have zones where they're delivering groceries or medicine, specifically to the people who didn't have the ability to stock up. We want to see clear instructions in different languages in the grocery stores, reminding people to show social distancing. We want everybody who's outside to be pushing this message, not just the NYPD, our sanitation workers, our MTA, everybody can be doing this. We did a poor job of putting a wartime plan in place. We have the ability to do that now. Everything we do, we'll see it show up 7 or 8 days later.
Public Advocate Jumaane Williams, there'll be a lot of looking in that rearview mirror about what was done, what wasn't done in the weeks ahead. But thank you for joining us this morning. We do appreciate your time and continue to stay safe to you, okay?
Thank you. But this plan is looking forward, and we can do it today.
Of course, absolutely. I agree with you. There's a plan to move forward, and we also have to look at what went wrong here as well at the same time.